Assalamu alaikum everyone. Today we're going to talk about Hornor syndrome. The Hornor syndrome is occurred by the defect, the sympathetic innervation of the face and the eye. Okay. First of all, I'm going to provide information about the anatomy of the sympathetic innervation of the eye and the face. Okay. Look at that. And there is a diencephalon. That's the initial part of the sympathetic nervous system. Central sympathetic pathways descends to the spinal cord contralaterally, okay? And after getting the certain segment, they synapse with second neurons, and second neurons are directed to the superior cervical ganglion. After reaching there, the second neurons connect with the third neuron. Third main function is arriving to the organs and activating their function. Okay, look at that. There is several parts of the face and eyes that's innervated by the sympathetic nervous system. First one is superior tarsal muscle. Superior tarsal muscle's main function is holding the opened eyelid. Okay. And there is a partner of the superior tarsal muscle, that's the inferior tarsal muscle. Okay, look at that. And the next innervation is orbitalis muscle. Orbitalis muscle's main function is holding the eyeball in the normal protruded position. Okay, and the next innervation is dilator pupillar muscle. With dilator pupillar muscle activation, we can watch the patient's dilation of the pupilla, okay? And the next structures are sweat glands and blood vessels, okay? And what is the main reason for the Hornor syndrome? In fact, the Hornor syndrome is the damaging the sympathetic innervation of the face and the eyes, okay? And one of the main reasons for that is maybe tumors that's located in the spinal cord and the brain stem. Okay, maybe some kind of non-nervous tumors. For example, Pentecost tumor is located in the upper lobe of the lungs, and when they enlarge, they try to impinge on the sympathetic ganglion. Okay, most specifically superior cervical ganglion. As a result, the Hornor syndrome may occur, okay? And now I'm going to talk about the symptoms of the Hornor syndrome. First of all, look at that. The innervation, lack of innervation of the superior tarsal muscle can cause the narrowing of the palpebral fissure. As I mentioned above, the main function of the superior tarsal muscle is holding the opened eyelid in some kind of position. Without activation of these muscles, the eyelid maybe become this appearance, okay? That causes the narrowing of the palpebral fissure. The next symptom is due to the lack of innervation that by the sympathetic nervous system of the orbitalis muscle. The orbitalis muscle's main function is normally pushing toward the eyeballs, okay? Without its normal function, anaphthalmos may occur. And the next symptoms is due to lack of innervation of the dilator pupillar muscle. The dilator pupillar muscle's main function is enlarging the size of the pupil. Okay, without this function, miosis, constant small size of the pupilla may occur. You couldn't perform the light reflexes in this eye. Okay. The next symptoms is redness and anhidrosis. The sweat glands on the face is innervated. Not only the face, the whole body. The sweat glands is getting innervation from the sympathetic nervous system, and without this innervation, the sweat glands couldn't show its effect, and the anhidrosis may occur in the face, in the one side of the face. Okay, and the vasodilation. Vasodilation is due to lack of constriction of the blood vessels. The main function of the sympathetic nervous system is constricting the blood vessels when where the sympathetic nervous system innervates these blood vessels, and a lack of without any this sympathetic innervation, blood vessels couldn't constrict and vasodilation may occur, and on the one side, the affected side of the face become red. Okay, they are the main information about the Hornor syndrome and sympathetic innervation of the eyeball and the face. I lost the main information for you all today. Thanks for listening and watching. Take care of yourself.